Good evening, everyone. Thank you so much for joining us this evening, and would like to start off by thanking Mike Weber and Foxboro Cable Access for continuing to support us. They really continue to keep our community held together. They've done that for years, but particularly in the last 17 months, I don't really know how we could have done this without them. So thank you, Mike. And I would like to just start off this evening with introducing who we have here. With us, we have Rob Canfield, who is our chair of the school committee. Rob can give a little wave there. Also, Dr. Mello, the assistant superintendent, she's going to be facilitating the Q&A. So if you have questions this evening, you can put that in the Q&A function, and we'll get to those at the end. And then if we're not able to get to all of them, we'll download that so we have those questions going forward and can follow up after. We have Mr. Yukna, Bill Yukna, our manager of all facilities. He's here with us this evening. Aaron Heyer, our director of technology. Corey Makalazik, our director of student services. And then as far as our principals and assistant principals, I'll start off with Mike Stanton. Did you want to say a little bit of a hello?
Hi, everyone. Thanks for joining us. And we're excited to have the children come back soon.
And Michelle McCarthy over at the Borough.
Hi, everyone. We are especially excited with the opening in the new building this year. So look forward to seeing everyone at the open house.
All right. And Principal of the IGO, Kate Campbell.
Hi, everybody. I can't wait to see the kids and be back in action.
And Karen Frazier, the principal of the Ahern.
Hi, everyone. Happy to be here tonight and so looking forward to having our students back 5 days a week for hopefully the full school year. So thank you.
Great. Then we have Dr. DeMarco and Dr. Frazier, our assistant principals there at the Ahern.
Hi, everyone. Just looking forward to a great school year this year.
Hey. Hi.
All right. And Mrs. Myers-Packle, the principal of Foxborough High School.
Hi, good evening, everybody. We're so excited. We're already beginning to see our students back on campus. Band was starting up and we've got some sports that'll be happening. And we're just really looking forward to everybody coming back on a full-time basis this year at the start of September. Well, August, actually.
And then Miss Sylvia and Mr. Servideo.
We're ready to rock. Let's go.
We're excited to have everyone come back. We're looking forward to a good year.
And then we have Jen Rosenberg, our fearless nurse leader, who has really led us through this. And she's at the Ahern Middle School, but also the nurse leader for the district.
Hi, everyone. I echo everyone's sentiments. I'm so excited for everyone to be back in school and looking forward to seeing the students back in our buildings this year.
And then also with us this evening is Deputy Chief Tom Kenvan.
Hi, everyone. Thank you for having me.
So as we get started here, I'm just going to share some slides. And that's going to be what we're going to use to go through this presentation. And then again, we're going to be using the Q&A feature. So if you have questions that we can answer here at the end. So our agenda this evening is really to go over some of the district updates, what transportation looks like, the health and safety protocols, importantly, what's the same and what's different, a testing program that we're going to be engaging in through the Department of Ed, which is called Test and Stay. Nurse leader Jen Rosenberg will talk about that more specifically, and then Q&A here at the end. But just wanted to take a moment and kind of go over where we've been from the summer, particularly where we ended the school year with all students full in person. And that really was the best way for us to end the year. We've learned a lot in the last 17 months. We've learned that we needed to be really flexible. We were able to do something that we never thought possible. We've learned to work in new ways. We've learned to be patient. We've learned how critically important we knew the social emotional for our students, and supporting them there in addition to academics is critically important. The mental health and academics for our students. We've also heard from you how much you've appreciated your children's teachers and all that they've done over the most difficult year in education for sure. And with that, really, again, would like to take the opportunity to thank you for all the support that you've given us on what really has been an extraordinarily challenging 17 months. We have found many silver linings as well. We do expect to have bumps along the way. We know that the pandemic is not over, so we will continue to be flexible and patient. But at the same time, we know that we're in a very different place from when we had this virtual town hall call with our parents and our faculty and staff last summer. And we're really happy to say that we've jumped leaps from where we were, again, at the end of last school year. So what's taken place over the summer? On July 19th, the American Academy of Pediatrics came out and recommended that a layered approach is what makes schools safe. They also, in their guidance, included a recommendation that anyone older than age 2 wear masks, regardless of their vaccination status. Then on July 27th, the Centers for Disease and Control and Prevention, the CDC, they came out with the same suggestion, recommending that universal masking indoors for teachers, staff, and students and visitors to school, regardless of vaccination status. Then on the 30th of July, the Massachusetts Department of Elementary and Secondary Education, in collaboration with the Department of Public Health, DPH, their recommendation was strongly recommending that students K-6 wear masks when indoors, except for those who could not due to medical conditions or behavioral needs. And they also strongly recommended that unvaccinated staff in all grades, or students grades 7 and above, wear masks indoors. That was their advisory. Then on August the 2nd, our own Foxborough Board of Health met with their advisory, coming out and recommending that we in the school system follow the most recent CDC guidance for K-12 schools, which included wearing masks, again, that universal masking indoors. What I think is important to note is that a year ago at this time, when we began the school year, the Department of Ed was saying that we could be at 3 feet indoors, and the CDC said we needed to be at 6 feet. At that point in time, as most districts across the Commonwealth, we followed the CDC guidance. So continuing to follow the CDC guidance and staying consistent with that is something that we looked at, as well as the many meetings and conversations that we've had with our own public health officials. So as a result of those recommendations, you received from me last Friday the recommendation from myself based on all of this information to school committee, as it is a school committee policy with our current mask policy that we've had in place for a year now, that we continue with universal masking indoors. No masking outdoors, but when we are indoors. So other parts of this guidance that has changed and has come out, and amongst many different places where you see, we know that Massachusetts has among the highest vaccination rates across this nation out of all of the states. We also know that our vaccines are highly effective and that they're especially effective against severe disease. And we're watching those numbers very closely of what we can get that information and we'll continue with that and looking at our vaccination rates of those that are eligible to be vaccinated. Many of the previous measures for mitigation strategies in schools are no longer necessary. Again, we've learned a lot. Those would include things as touching surfaces and transmission when at the beginning of last year, as an example, not sharing materials, having a separate isolation room. So there's a number of things, including social distancing, that has now been lifted. So schools are going to look very different, more towards the traditional environment that we are more used to. It is a federal requirement that masks are still worn on buses and in nurses and health offices. It's also encouraged to maintain our ventilation upgrades from the past year, which we had a full study done last year. We're continuing with those, maintaining those upgrades, which has to do with our filters and replacing them quarterly. The isolation rooms, as I had just mentioned, is something that we no longer have to have in place. We still have double rooms with our nurses' offices, and that physical distancing, again, has been lifted. It's going to be really important, as we all know, those hygiene practices, to continue with those, staying home when students are sick, And that again, what's new is that the Department of Ed is working with CIC and having different testing opportunities for districts to engage in. There's 3 different opportunities that we can choose. We're going to talk about a test and stay program that we've been accepted into and will go forward with. It will involve parental consent, but we really see that as a game changer in keeping students in school. So when we think about keeping students in school, we know that part of this, what's the same as last year, the transportation, as I had said, it's a federal requirement to wear masks on buses. The windows will continue to be lowered. Obviously, inclement weather could make a difference, but we will have windows lowered. Assigned seats for our K-8 students. What's different is in last year, we had siblings that had to sit together. Sometimes when we think about our elementary students, our 4th graders, they may have had a kindergarten sibling, and they're the big kids. They get to sit at the back of the bus. They'll be able to sit where they more traditionally have looked forward to and not have to sit with siblings on the bus. Contact tracing on buses is no longer required because of masks and because of windows down, so social distancing is not required. Our vaccination data for Foxborough, when we look at the age groups from 12 to 15-year-olds, at this point right now, as of August the 10th, we are able to see with our youngsters that the partially vaccinated rate is 62%. That's just under the state average of 63%, and 16 to 19-year-olds at 77% is above the state average at this point in time, which is 62%. So we're then looking at fully vaccinated individuals at those age groups. And we also understand by looking at how those numbers are grouped, the ages themselves, is that we have to keep in mind with 18 and 19-year-olds, those could be a number of our graduates. And as universities and colleges are requiring students to become vaccinated, it's important for us to be able to tease out at what grade level, age level, those vaccination rates are taking place. And that's information that as the school year begins, we'll be able to get a better idea. But it's important to know that we're watching that very closely and we'll continue to watch that and have those conversations with our public health officials to where is the tipping point, what makes a difference, where we're recommending masks going forward. So the health and safety protocols, the mask not outside, so any athletics, our music, our band camps, extracurricular activities, outdoors, teachers, when they take students outdoors, just to be in an outdoor learning environment, masks are not required. As far as contact tracing, again, we're still going to have assigned seats in our classrooms. And for lunches at the elementary level and then up towards the middle school level, we're able to have assigned seats or tables. At the high school level, it looks a little bit different. We're reducing the number of students to a table to where it's only 6 students per table. They also will have QR codes, so that way we know who was sitting at which tables. The good hygiene practices will continue. The disinfecting wipes and the sanitizing stations will all still be in place. We know that that was something that was really important to teachers last year and having all of that readily available, and we will have plenty of that for them. The electrostatic misters, you might remember us talking about those last year. That's something that we use as an additional sanitation measure, and we will continue with those. The difference will be that we'll be using those daily, but not between every single bus run and not between every single lunch. Again, we've learned that it's not so much the touch surfaces as far as the concern. As far as restrooms, that's going to be a place where a lot of our protocols will stay in place from the past when we think about the number of students in a restroom and which restrooms are available at different times during the school day. And that more so at the high school level, and students are more familiar with which bathrooms at different times. And as an example, we will have the bathrooms that are closed during passing times. So what remains the same? Again, the good hygiene practices, having the materials in classrooms so they have plenty of inventory for hand sanitizer and wipes. It was something that came out that regardless of living in a COVID year, that it really made a nice difference having all of those wipes to be able to wipe down desks after each class. The thorough disinfection of schools and school spaces will continue. Again, the upgraded ventilation system, the assigned seating, which is going to be important still for contact tracing, encouraging the hand washing, staying home when sick, monitoring the symptoms daily. The symptoms have changed and been added a little bit. They're more in combination with other symptoms. Ms. Rosenberg will talk about that a little bit here in a few minutes. And that we will continue, importantly, to communicate and be transparent as far as when we have positive cases and contact parents to let them know if there's been a case or if your child has been deemed a close contact. When we talk about the testing program that's going to be in place this year, that really is a game changer for us, importantly, in keeping children in school. When we think back to the positive cases, that we had last year, and then contact tracing and the protocols that we had to follow, much more stringent and resulting in many students being out of school. We know it's important for them to be in school for academic, social, emotional, mental health, all of those things. And the more that we can not disrupt their educational environment, and honestly, yours as families too, we know that you're working and it's also hard when your students are not in school and quarantining, and heard many examples of, it's hard because of trying to figure out work schedules. And if we're able to provide an opportunity with parental consent to have students, if they have been deemed a close contact, to stay in school, then that will keep our students here and be less disruptive for them. And you'll hear about what that looks like, and even based on the measures that we're going to have in place, what will have students to be even exempt from that testing and to be able to stay in schools. Like last year, it will be free breakfast and lunch for all students. We'll be you would have just received a communication from Janice Watt, our Director of Food Service, with directions that talked about what you needed to do as far as food service, and that again, that it will be free breakfast and lunch all school year. Last night at our school committee meeting, we had the first read of an amended policy. We currently have a mask policy in place, and we had amendments to that policy because of how some of these guidelines have changed. Specifically, when we think about being on school property outdoors, not needing to wear a mask. And the indoor mask wearing is the recommendation going forward. And that is a vote that they will have at their next school committee meeting when they review that policy for the second time, which is next Tuesday. So what is different? The social distancing requirements is different. We no longer have the big circles everywhere on buses in the hallways with hallways marked with arrows. All of those social distancing requirements have been lifted. Lunch will not be prepackaged. We're going back to a traditional lunch service using our point of sales system for students. When they come to lunch, they will be able to go in. Again, they're not paying for lunch, but it's important that they put their code in because we have to track that information because of the lunches being free, obviously. And this is the part that we're honestly most excited about, is returning to what we know is more of our traditional classroom. When we think about teaching and learning being social, being able to have students in groups working together, not being in desks that are facing forward in one direction, having them to be able at our lower levels, to be able to sit on the rugs in groups, our small group instruction that's so important, and having them being able to face each other. Assigned lockers. We did not use lockers last year. We also know that there's a lot of students that choose not to use their lockers, but having them that they're available. No cohorting. That is a difference. Again, no mask outdoors, and there will be no remote learning options. So last year, students that chose to be fully remote had the option. They were still enrolled in the Foxborough Public Schools. The Department of Education has said that we can no longer do that. It's always a family's choice. If they choose not to have their student in person, which is our focus going forward as we're required to do, a family always has that choice. And the difference is that they would be unenrolling from the schools, and it would be more like a homeschool situation where we do have students that are homeschooled. Universal masking, the recommendation. Why are we recommending this? We're recommending it again because we want to be in person with the least amount of disruption as possible. That's our goal. We can't be fully in person and be at 6 feet. So if we have masks on, you'll hear in a moment about when it comes to the test and stay and not having to quarantine, the big difference that makes. Our current vaccination metrics, again, looking at where we are with those that are eligible to be vaccinated, where we're hovering at 62% and 77% for our 16 to 19-year-olds, watching those percents increase. We're going to be watching that weekly. We also know that the Delta variant is what's present in our region, and it's highly contagious. Being consistent with the CDC recommendations, as I mentioned earlier, and then the important recommendation from our health officials and the experts when we look to also our Foxborough Board of Health. So testing and stay. What does that mean for us, and what does that look like, and what does it mean for your student? There are 3 different testing options programs the Department of Ed is sponsoring and that we were able to apply for. There's symptomatic testing and test and stay, which is more diagnostic testing. And there's pooled testing, which they engaged in some districts last year in different parts of the Commonwealth. We are going to be focusing and engaging in test and stay. We can always add additional options, but to start the school year, we're going to be looking at this particular program and have already been accepted into this program. So I'll turn it over to Ms. Rosenberg and let her give you a little bit more specifics of what this means.
Thank you, Dr. Bertos. I think we all were hoping for a completely normal return to school. But I think it's important to remember that the layering of all the mitigation strategies that we have in place will give us our best opportunity to keep our children in school. And I think that's the ultimate goal. And we have to remember that, one of the, being masked back at school was probably not what we were hoping for at the end of the school year and beginning of the summer. But at this point in time, I think it makes most sense for where our community is. And like Dr. Burrows has said in the past, this situation is fluid. We're ready to pivot at any time, and we're going to be continuing monitoring the prevalence rates in our town to see if anything changes. But we were very excited last week when the state announced this new test and stay program. We are going to be able to offer our students, I think one of the biggest challenges last year for our teachers and our parents, and probably one of the definitely most difficult phone calls that the nurses had to make was when a child was deemed a close contact in the school setting. We had to, let the parent know that child had to stay at home for a week and be tested on day 5. So it was a difficult phone call to make. But this year we're going to have the opportunity to have a company come in. The CIC will come in. If a student is deemed a close contact, then they will be allowed to stay in school with this test and stay program. They will be tested daily at school with a rapid BinaxNOW rapid antigen test. And as long as the student remains negative without any symptoms, they will be allowed to stay in school. They'll be tested for at least 5 days straight for a total of 7 days from the time of exposure. We will have an opportunity, they're telling us that we'll have an opportunity to test on the weekends for extracurricular activities for the students to be able to participate in those. There will be exemptions to the test and stay where students would not have to be tested if they were deemed a close contact. Those individuals that are fully vaccinated that remain asymptomatic do not have to participate in the testing. If the students are greater than 3 feet and they're masked in the classroom, they would not be considered a close contact in school. Any students on the bus with as long as they are wearing their masks and the windows are down, they would not need to be tested, or any individual that was tested in the last 90 days prior to the exposure tested positive for COVID. So those individuals would be exempt from the testing. It's important to remember, even with the testing, individuals should monitor their symptoms for the full 14 days, as we still know that the incubation period is the 2 to 14 days. We also, as far as symptoms, it's really, again, we talk about this layering of the mitigation strategies that we have. We really, last year, parents did an amazing job keeping their kids home at school. It really was a team game. The communication was incredible between the staff, the nurses, the parents, and we want to continue that. I think that will give us our best chance to keep our students in school. So you want to monitor your students for fevers, difficulty breathing, new loss in taste or smell, or muscle or body aches. Those symptoms if they stand alone, you should reach out to a healthcare provider for follow-up. Also, again, symptoms of COVID include cough, sore throat, nausea, vomiting, diarrhea, headache, and fatigue when in combination, nasal congestion when in combination with any of the other above listed symptoms. And we're working on updating our website. A lot of the COVID data that we have currently up there has changed. So in the next couple of weeks, we'll be updating with the new information on the test and stay, the symptoms for COVID to monitor, and anything else that has, things are changing daily again as they were last year. But we really encourage you. Any questions, reach out to your school nurses. Last year, they were amazing. I can't say enough about the team that Foxborough has, and along with our partnership with the local Board of Health, it really has made a difference. We're so lucky to have Tom Kenvin and his crew over at the local Board of Health, because I think that has made a huge difference in our last year and able to keep our students in the school.
Nurse, we have a couple of questions that are directed at you. One is asking what type of test it is. Is it a nasal swab? Is it a cheek swab? Can you talk a little bit about that?
Sure, great question. So it's an interior nasal swab, and it's an antigen test. It's a rapid antigen test.
Can we talk about, we have explored pool testing in the past, and there's several questions about if we are participating, if not, why not?
Right. We had talked about this last year, and we still continue to talk about it. I've done a little bit of research around talking to area district nurses that have used pool testing last year. And there was definitely some mixed reviews as far as the amount of work that it took for the little yield. There was not a lot of the percent positivity rate was extremely low. A lot of nurses, they said it made the students more anxious than it was worth. And also it's a volunteer program, so not everyone participated. So it wasn't, you have to rely on who's volunteering in order to participate. So at this time, I think based on our prevalence rate in Foxborough, I think we're going to hold off on the pool testing. They are giving this year, actually, they've tweaked the pool testing a little bit, because they've, with any new thing that comes out, they've improved it. So there are better options. Last year, they didn't have the ability to reflex test right away, where they would have to re-swab people. This year, they off of that. So that's a positive in my eyes. But at this time, we're going to hold off on the pool testing. We're going to start with the test and stay and see how that goes. And then we can, like Dr. Berto said, we can always revisit it if needed.
There's actually a question regarding test and stay. So because it needs parental consent, if a parent does not consent and students are required to quarantine, how long is the quarantine?
Great question. Yeah, so we're going to stick with how we ended the last year. So it would be, you would have to do 7 full days of quarantine, testing on day 5 or later. And as long as you're negative and have not exhibited any symptoms of COVID, you can return to school on that day 8 with a negative antigen or PCR test.
If students aren't able to do a nose swab, is there another option?
They do have saliva testing for the pool testing, but not for the test and stay option. It's only a nasal, interior nasal swab.
I've heard some districts are providing tests for each family to keep at home. Will tests be made available to families for home use? I don't think so. Right.
We haven't talked about that.
So there's one question. If my child is deemed, and this may be more for Dr. Berdos or someone else, if my child is deemed to be in close contact and needs to be tested, will they still be able to take the bus?
As long as they are negative, they'll be able to continue on the bus, just as they're able to stay in a classroom.
Yes, the only restrictions when someone is deemed a close contact, they just ask that that person actively monitor symptoms, wear masks at all times, and which we all are doing indoors, and then try to maintain that 3-foot distance. Again, it's all these layering of these mitigation strategies that are going to give us the best outcome.
And I think the next couple of questions relate to how much more information we have now, as you mentioned, for example, not being on surface, not transmissible that way. There's a couple questions around it seeming to be more serious with Delta variant, and how come 3 feet is not considered a close contact, even though it's more contagious than last year.
So the data we had last year at the end of the year with the 3 feet, again, we had quarantined hundreds of kids throughout the year, and not one child became positive after being considered a close contact. So we have that data, and we're going to start the year with these recommendations. And again, if we find that something is changing, we can adjust and as needed.
I'm wondering maybe if Deputy Chief Kenvan could give a little bit of context for Foxborough for us.
Certainly. Hi, everyone. Good evening. So we have seen an increase in cases in Foxborough over the last 2 weeks, roughly around 42 cases. And that's a significant increase we've seen previously to that. We've also seen our positivity percentage go up to just under 3% at 2.97%. And that's also a jump of about 1.3% from the previous week. So we are seeing that cases are increasing. Fortunately, it doesn't appear that we have too many hospitalizations requiring significant resources. However, we are seeing an increase in cases. And I think taking that into consideration, recommendations by the CDC and the Mass Medical Association, as well as Massachusetts Association, I think it's prudent to endorse the wearing of masks for those reasons.
There's a question here regarding the vaccination status of teachers being disclosed.
At this point in time, we do not have a specific number. We feel confident that we have a very high percentage of teachers that have been vaccinated based on the information we had at the end of the school year. And we will be looking for that information to have more of a specific number as the school year starts.
Okay, I think Mr. Heyer wanted to answer a question regarding where the slides for this presentation will be available.
Well, I can answer that. We'll have this whole presentation. It will be recorded, and then we can also put the slides up on our website. So we have those on the COVID page. As Ms. Rosenberg said, we're in the middle of updating, taking some things that are not applicable anymore, and we can put those slides there, in addition to having the recording of this posted.
If the vote for indoor mask mandate is next week and the school board votes against it, or I guess either way, will new policy and procedure be shared with families?
We will share whatever takes place.
Will there be social distancing at lunch? 6 feet, 3 feet? Sorry if this was already said.
At lunch, it will not be 6 feet. We've been able to take all of our desks out of the cafeterias and put tables back in the cafeterias. What we'll see is a difference. When I think about the high school level as an example, students will congregate, many of them around a table. They're going to be limited to 6 students at a table. So that way we have the distance. They'll be wearing masks as long as the mask policy is continued to stay in place as they're walking through the line to get their lunch. It'll be once they sit down, masks will be off for that time. We're also going to have outdoor lunches when we can, being outdoors as much as possible, but masks will be off during lunch.
Just trying to, there's a few questions here. I think what you're saying, I'm just going back to the vaccination status of teachers, that would never be shared by teacher because of privacy issues. It would just be a general number, correct?
Correct.
There were several questions related to that. I think there was a couple questions about why there is no remote learning this year. So maybe you could address that, Dr. Bertos.
So last year was very unique, and because of the pandemic, the Department of Ed required us to have another learning option. And that option being for students that did not feel comfortable for a host of different reasons, or family situations where they were not in person. That was just for last year. Our focus, all schools we're in person, we're 5 days. It doesn't count for learning time anymore. You might remember when we came back in April, the remote days that we even had for our hybrid learners, that time would not count towards the student regulation of time on learning, and that we had to be in person 5 days. At that point in time, we were essentially running like 2 different school systems at once, and that option from the Department of Ed has been taken away, and they will always have the opportunity, as I said early on, for parents to have that choice, but it would not be as a student that's enrolled in our school at that time.
Some people, there's 2 people in the chat who are wondering, hold on, I'm trying to find it. Oh, one is does the mask mandate also, if we do it, does it apply to pre-K?
Yeah, Michelle, I don't know if you want to talk a little bit about our preschoolers and masks.
Sure. Yes. Last year, the pre-K did wear masks as well, and we were actually really impressed with how well they did. It's, occasionally they'd slip down, but with a quick reminder to pull it up, they were on that. So they did it. They did a great job. So yes, it is mandated in pre-K as well.
Does Mr. Michael Lasik have any specific information regarding students who receive special education services?
So special education services would continue as it normally would in a 5-day school week. We're not going to be doing ISLPs. That was only as a result of the hybrid learning and what students would receive during remote learning. But because students are in 5 days a week, there is no change to their IEPs via the ISLPs. Instead, we're just going to utilize their IEPs like we normally would.
Okay. Will parents, guardians be allowed in the buildings for team meetings and such?
So at this point, we are going to continue our remote team meetings until we decide otherwise.
Sorry, I'm trying to respond here. So if someone at the lunch table has COVID, are they considered a close contact if your child is, oh, you're doing that one? Yeah, Jen, are you going to answer that one?
I'll answer it. Yes. So yeah, we would consider the entire table a close contact, be on the safe side. But again, with the test and stay, that shouldn't disrupt any in-person learning.
Okay.
Allison, while you're looking at the questions, I know that I want to be cognizant of our time and everyone here on our panel. So, Mr. Yukna, is there anything from a facility standpoint that you would like to share with parents and guardians?
I think in general, the concept that we're going to adopt for this year was similar to what we adopted for last year. We've ordered plenty of supplies to have them in classrooms, hallways. Our cleaning crews understand the philosophy we had last year and that we're going to continue to do that. The one thing that we won't do probably to the level that we did it last year, which was the hydrostatic spraying, but it will be done every single day at the end of every day in every room as an added precaution. I think the cleanliness of the buildings is a typical responsibility that we take no matter whether we're in a pandemic or not. And we will continue our processes that way, as well as what we do within all of our food service areas as well. So we're comfortable that we've ordered the supplies and materials that we need to have. Like last year, we were very well prepared for it. And I think we managed very well through the process.
And generally speaking, we'll continue to have communications going out at each of the levels. The example that was asked with the IEP meetings, one of the things that we heard from parents on our culture and climate survey was how much they enjoyed having the virtual conferences as an example. They were able to participate when many times it really was a barrier to be able to get to the school and to participate. So things like virtual conferences, certain presentations that we did, we really had good feedback that they worked well. They were more accessible to more people. So you'll see those kinds of things, which was kind of a silver lining as we came out of last year. At the same time, we're going to be limiting a lot of traffic in the school building. So when we think about some of the volunteers to the level, that's going to look a little bit different just as we start the school year. When we look at our open houses, we still plan on having those in person. But again, we're going to have some different mitigation strategies to be able to make those successful and how we're organizing those. So we ask that you continue to be there and support us as we start the school year, which will thankfully be very different than last year. Help us to continue to be flexible and patient as we move forward. And most importantly, to be able to have our students back in school 5 days and to keep them in school and to keep them safe and in a learning environment that's engaging. So I don't know, Dr. Mello, if there are any last questions before we ended.
I think there's one that's, sorry, I'd like to take advantage of the principals here if they need to share any important information for drop off and pickup with walkers. Will the process be different this year? And are there any specific changes that need to be mentioned at this time? I don't know if that applies to anybody.
No, I think we'll probably send out building-based updates with that piece, but we, probably similar to the end of last year in the spring and the June, that it'll look at least at the elementaries.
Yes, I would echo that for the middle school as well. I think from a parent perspective, probably not major differences in terms of where students are getting dropped off, but we'll be working with them as in terms of where they're entering the building and how they're getting to their classrooms once they're inside.
And from the high school, as far as drop-offs are concerned, or the buses, all of those things from the exterior will remain the same. And any changes inside the building will be sharing those with the students. I would urge parents, though, if they could leave a little bit earlier, we'd greatly appreciate that so that the students are not late coming in.
One other reminder for the beginning of the school year is our students 6 to 12 have their laptops at home, and we'll be bringing those back. Make sure they're bringing them with their chargers. If they're going to be, we want them together because they will be using those. We know over the summer they may have been idle and they may have been used a lot. So I don't know, Mr. Heyer, if there's anything you wanted to add when we're thinking about from the technology standpoint and bringing those devices back.
Well, first, we're really excited to have our students back in the building and be a one-to-one district and have all the technology and digital learning resources that we have. So if your students haven't been using their laptops throughout the summer, next week would be a good time to make sure that they're charged up and ready to come back into the building. Starting tomorrow, we will be doing maintenance on student accounts. So student accounts will be unavailable for a couple of days. But later in the week, students will be able to look up their new username and passwords using the Power School student and parent portal and get logged in and make sure their machines are ready to get back to learning. So we look forward to welcoming you back.
Quick question, Mr. Heyer. If a child didn't receive a laptop, they should not bring their personal laptop. They should receive a laptop.
No, so all students that are returning from cohort D or remote learning options last year that did not receive a laptop, you'll receive a laptop likely on the first day of school when you return. And then any student that's a new student that will be attending the Foxborough Public Schools will also receive a computer on the first day of school as well.
All right, well, with that, I'd like to thank everyone for joining us this evening and to thank all of our panelists that are here, particularly Deputy Chief Kinvin for joining us last night at school committee, as well as again tonight for this meeting. Thanks again to Mike Weber, and then all of our nurses and Mr. Canfield and the school committee and all the work that they're doing. So have a good night. We wish everyone a great start to the school year. Again, we can't wait to see our students return and to have a really great 21-22 school year. Thanks so much and have a great night.